Hi, my name is Alexia Floriano. I am a medical doctor from Brazil, and today I'm going to be sharing our systematic review and meta-analysis on how the timing of laparoscopic ovarian cystectomy could affect the ovarian reserve markers, especially in women of reproductive age. So a little bit about us. We are an independent research team put together by Dr. Chakoiri Ayagu. We are medical doctors from Brazil, the United States, India, and United Kingdom. We all share this common interest in women's health and evidence-based medicine. And so to start off our topic, it's well established that the laparoscopic ovarian cystectomy is the standard approach in dealing with benign ovarian cysts, and that is because it relieves the patient's symptoms. It also prevents complications like ovarian torsion or even ruptures. And also because it's important to confirm the benign pathology of the cyst. And for us, in the case for our study, is looking at the fertility preservation aspect, because when doing the laparoscopic ovarian cystectomy, you want to preserve as much as healthy ovarian tissue as possible. So here on the image, you can see an ovarian cystectomy for a right endometriotic cyst. So that is the goal of the surgery. So we hypothesized that doing the surgery in the follicular phase or the luteal phase could change the outcomes. And we know that because the follicular phase is characterized by a higher estrogen with increased blood flow and oxygenation to the organs, so that could cause more intraoperative bleeding. And because of that, it could have a smaller postoperative anti-mullary hormone decrease. On the other hand, the luteal phase has a higher progesterone and lower perfusion, which in a good way, it would cause less intraoperative bleeding, but it could impact on the tissue repair after the surgery. So it could increase the decrease rate of AMH. So it's something that we looked at. So the objective of our study was to evaluate through a meta-analysis the effect of surgical timing, either the luteal or the follicular phase, on the laparoscopic ovarian cystectomy on postoperative ovarian reserve markers. So we looked at the anti-mullary hormone and how that affects reproductive age women with benign ovarian cysts. So our study, we did a systematic review of the literature. So we screened about 1,646 papers. We excluded them based on the inclusion and exclusion criteria. Most of them were excluded because they either didn't mention the menstrual phase that they were performing the surgery, or they didn't compare. So we could only find 3 studies. And we followed the Prisma flow diagram for study screening and the selection. We summarize the study's characteristics. So there are a little bit of a difference between the 3 studies. The Song from 2017, he included women with other types of cysts other than endometrioma, and the other 2, they only included endometrioma cysts, as well as the bilaterally of the cysts. 2 of them only included unilateral cysts, and Song included also bilateral. But they all measured the preoperative AMH and the postoperative AMH. This was our primary outcome, the AMH decrease rate. So in this meta-analysis, you can see the postoperative AMH decrease rate by the menstrual phase. So as you can see here, there is a greater AMH decline in the luteal phase. So that suggests that performing the surgery in the follicular phase may better preserve the ovarian reservoir. And it is a statistic significant because there's a p-value of 0.04. So that is a good thing. But on the other hand, the secondary outcomes, the postoperative AMH, which is the absolute value of the AMH, it didn't reach statistical significance, but you can see that there's a trend going more towards the follicular phase, so having a greater AMH in the follicular phase, but not statistically significant. Operation time by menstrual phase, there were no significant difference observed between operation phase. So that means that doing the surgery in either phase probably it doesn't correlate with how difficult it is or how long it's going to take. The blood loss, the same thing. There's no significant difference between the phases. And the intraoperative blood loss. So it shouldn't be something that we also need to worry about if it's going to bleed more in the follicular or the luteal phase. So our conclusion is that the timing of the laparoscopic cystectomy within the menstrual cycle may influence the postoperative ovarian reservoir, but it's something that we need to be careful to say, because we have a small sample size. We only found studies compromising 298 women, so it's not a very big sample size. There was also heterogeneity in the population, so unilateral and bilateral cysts, as well as other types of cysts, not only endometrioma. And this is the first meta-analysis on this topic, so it's a very new topic. So further studies are needed to confirm this effect and to identify if there is, in fact, a optimal timing of doing the laparoscopic ovarian cystectomy to preserve the ovarian function. Thank you for your attention.